If your MRI says L4, L5, or L5-S1 disc bulge, the scarier part usually isn't the description of the disc injury, it's what you've been led to believe that sentence means. I see this all the time. Someone gets an MRI, they read words like bulge, herniation, protrusion, degeneration, and instantly assume that they found the cause of their pain and a preview of their future. It's that word prognosis, right? Then they're told that it looks bad with no real explanation and no treatment plan. Here's the contradiction most people never hear. Two people can have the same L4, L5, or L5-S1 findings, and one can be in severe pain while the other feels completely normal. If the MRI automatically predicted pain, that wouldn't happen. So what actually decides whether a disc bulge becomes a problem? It's usually not the size, it's what the image can't tell you. How the spine and the injured discs are behaving under load, whether a nerve is irritated, and how your spine is handling its daily movement. So in this video, I'll show you how to interpret an L4-L5 or L5-S1 bulge the right way, why the report often sounds scarier than the situation really is, and the 4 clarifications every disc bulge patient needs before they let fear, injections, or surgery drive the next step. Because your MRI is descriptive, not predictive. And once you understand that, your options get a lot clearer. Hey, I'm Dr. Paul Barnwell, chiropractor in Katy, Texas. For more than 10 years, I've helped people get out of pain and return to a life they want using natural care instead of drugs and surgery. My mission is to help people understand their bodies and to build long-term health so they can live with confidence and purpose. So if you're dealing with chronic pain, failed treatments, repeated flare-ups, or surgery being recommended without a real plan, this channel's for you. You deserve clear answers, not quick fixes. In this channel, you'll learn what's actually happening inside your body, what actually helps it heal, and the information most people never hear in a routine doctor's appointment. So subscribe if you want to understand your body better, reclaim your health, and get practical steps you can use right away to move toward a life with less pain and more purpose. I upload a new video every week. Stay tuned. First, let's clear up the misunderstanding that fuels most of the fear around MRI reports. What a disc bulge actually is and what it does not mean for your spine. This is clarification number 1. A disc bulge simply means that the disc has changed shape under pressure. It does not automatically mean that the disc is torn. It does not automatically mean a nerve is damaged. It does not automatically mean your spine is unstable. In many cases, a disc bulge is stable. It adapts over time, especially when the spine is moving and loading in a controlled way. This is why so many people have disc bulges and never experience pain, weakness, or limitations at all. Research supports this, and it matches what we see clinically. Most people with disc bulges, and even many with disc herniations, improve without surgery. With conservative care and proper movement, symptoms often calm even when the MRI looks concerning. This is also why imaging findings and pain levels do not always match. I see patients with visible bulges who move well and feel fine. I also see people with very small changes on MRI who are struggling significantly. The image alone does not tell the full story. This brings us to clarification number 2. Where a disc bulge sits matters more than how big it looks on an MRI report when it comes to pain. A posterior central disc bulge means the disc is bulging straight backward toward the center of the spinal canal. This type often affects tolerance to sitting, bending forward, or staying in one position too long. People may feel aching in the low back, stiffness after sitting, or pain that worsens with prolonged bending, forward flexion, because the bulge is centered. It may not strongly irritate one specific nerve, which is why symptoms are sometimes more diffuse and less clearly on one side. A posterior lateral disc bulge, meaning to one side, sits slightly on a particular side, closer to where the individual nerves exit the spine. These bulges are more likely to irritate a specific nerve root. That's why they're more commonly associated with leg pain, tingling, numbness, weakness that follows a predictable pattern down one side of the body. Daily activities like walking, standing, or twisting can provoke these, and with improper load can repeatedly irritate the nerve. A foraminal disc bulge extends into the opening where the nerve exits the spine. Even when these bulges are small, They can be very symptomatic because space in that area is limited. People often notice sharp or electric symptoms with standing, walking, or extending the spine. This is another example of why millimeters alone on an MRI report don't tell the full story. A broad-based disc bulge means the disc is bulging over a wider area rather than in one focal spot. These are often described in alarming language on reports, but many are stable and well tolerated. Symptoms usually depend on how the spine is loaded throughout the day. Long periods of sitting, poor movement variety, or sudden increases in activity can make these feel worse, while consistent movement and better load distribution often help. At L4, L5, and L5-S1, these location differences matter even more. At L4, L5, nerve irritation commonly shows up as pain that travels down the leg toward the calf or ankle. At L5-S1, symptoms often affect sitting tolerance, bending, or sensations into the foot. A small bulge in a sensitive location could cause more trouble than a larger bulge elsewhere. Another key factor is nerve sensitivity, which an MRI can't measure. Some nerves calm down quickly once stress is reduced. Others stay reactive longer, especially when they're repeatedly irritated by posture, movement habits, or constant guarding. The MRI shows structure. It does not show how sensitive the system has become. This is why focusing only on disc size misses what actually drives the pain. Pain depends on how your spine and nerves respond to daily movement and load, not just what the report lists on paper. By now, you understand two important things. A disc bulge does not automatically mean pain. And where a disc bulge sits matters more than how large it looks on a report. The third clarification is this. An MRI does not show how your spine is functioning in real life. An MRI is taken while you're lying still, but pain rarely shows up when you're not moving. It shows up when you sit, bend, walk, lift, or stay in one position too long. An MRI can't show you how your spine handles those movements or how well different areas share the load during your daily activities. It also can't show stability. The image doesn't tell us whether your muscles are supporting your spine consistently throughout the day or if certain segments are being overloaded. It can't show how much tension you carry when you're guarding against pain or how sensitive your nerves have become after repeated irritations. Once you understand what an MRI can and cannot tell you, the next common mistake becomes easier to see. Many people are told to either rest completely or stretch and hope things improve. While that sounds reasonable, it often keeps symptoms stuck. Too much rest lowers the spine's tolerance to normal activity. Random stretching or unplanned movement can keep irritated tissues stressed. Long periods of sitting, followed by sudden activity or avoiding movement for weeks and then doing too much at once, creates inconsistent loading. Discs do not respond well to that kind of unpredictability. Discs respond best to consistency. They tolerate controlled movement, stable positioning, and gradual reloading over time. When the spine knows what to expect, irritation tends to settle. When load is chaotic, symptoms tend to linger. This is something I see often in practice. A patient comes in convinced their MRI means that they're fragile. They move less, guard every position, and their pain slowly expands into more activities. Once they understand the image is information rather than a prediction, we change how their spine is loaded, not aggressively, not randomly, step by step with specific treatment methods that we'll talk about in a future video. As tolerance improves, confidence improves. As confidence improves, symptoms usually do too. This approach is safe. Nothing here involves ignoring imaging, minimizing symptoms, or avoiding appropriate medical care. MRIs still have value. Surgery and injections are sometimes necessary, and they exist for a good reason. The difference is knowing when those options make sense and when fear is making the decision instead. Understanding how your spine functions and what your MRI report means gives you back control. It helps you make better decisions, move with more confidence, and stop letting an image dictate your future. If this video gave you clarity about your MRI and helped reduce some of the fear around your spine, please like and share it with someone who may be struggling with the same questions. If you still have questions about your MRI report or how your symptoms fit into what we discussed, drop them in the comments below. I read every comment. And remember to subscribe if you want to understand your body better, reclaim your health, and get practical steps you can use right away to move toward a life with less pain and more purpose. The next video that you should watch is about L4-L5 disc bulges and the 5 exercises I teach patients to help them move with more confidence and relief. So go watch that video next. I'm Dr. Barnwell. I'll see you soon.